On behalf of KL Startup Summit 2021, we'd like to thank everyone for taking your time off on a Sunday to join me and our fellow esteemed panelists for this session. Hope everyone has their cup of coffee or tea. My name is Chiak, I'm from DoctorOnCall, and I'll be your moderator for today's first session of the Health Tech track, Digital Disruption Across the Healthcare Industry. So over here at the sunny KL, I'm chuffed to announce that we have a set of great panelists. We have Kenneth from Shopee, Wee Yong from Esyms, Ying from Smartpeep, Rajifah from Data 8, Ricardo from AstraZeneca. Apologies for that. I didn't miss anyone else. Yeah. So we have an exciting 1 hour ahead of us. So without further ado, maybe perhaps I just pass the stage over to each of the panelists and how the organization has kind of transformed and kind of forged ahead in this day and age where everyone lives and breathes digital. So perhaps let's get the ball rolling and we'll pass the stage over to Kenneth from Shopee first. Over to you, Kenneth.
Hi, good morning, everyone. Thanks for having me here today. Yeah. So maybe just a brief introduction. So I'm from Shopee. So Shopee essentially, I hope most of you use it. So yeah, we are e-commerce platform. Has been around since 2015. Actually considered relatively young as a company. We have grown quite a bit since then. So we're active in Southeast Asia and Taiwan. To be leading in these regions so far. So very much thankful to our partners, to our customers for all that. Essentially, we are a platform, right? So just connecting supply and demand between sellers and buyers across all categories. With COVID last year, it was a very interesting experience as the requirements change and the entire landscape also changed even operationally. So I'll be happy to share some of those observations or thoughts as we go about today. Yeah. Thanks.
Thanks, Kenneth. Great introduction. So let's move on. Let's go ahead and pass the mic over to Wee Yong from Esyms. Over to you.
Okay. Hi, everybody. Good morning. Thanks for having me. Okay, basically, all right, my platform will be Esyms. Basically, when I founded Esyms, what we ever think of is just to combine all the community pharmacies into a single platform. So when I named the company Esyms, actually E stands for electronic, e-health, and e-commerce, while Syms actually stands for symbiosis. So as the name suggests, whatever that I would like to propose will be a platform, we can bring in all the stakeholders, all the healthcare providers, into one platform where we can work together to provide a better healthcare and delivery. And of course, initially when we planned of, just getting the pharmacies providing, all the, instead of customers going to the pharmacy, of course, whatever that we think of was, just to bring the whole delivery, the pharmacy to your doorsteps, including the pharmacists. So, of course, by doing down the road, as we expand, as we move on, we realize there's some, obstacles here and there. And, it's not as straightforward as it seems because as a Esyms name, as easy as it seems, that's what we were supposed to deliver. But as we move on, we found that, there are just more and more things that we need to tackle. That's why, an event like this and a platform like this where we get to meet all the stakeholders and, everybody in the healthcare will be very much, helpful to us, to build and to further improve whatever system that we're trying to build. Ultimately, just to, improve the delivery of quality pharmacy care. So it's okay, but as we move on later, I will try to, discuss further on things that we're facing and, all the problems that we're facing and the kind of service that we can provide to improve. Yeah, thank you.
Thank you, Wee Yong. Maybe let's move ahead in the interest of time. Ying from Smartpeep, over to you.
Thank you for the introductions. Thank you, DoctorOnCall, for having me today here. Hello, everyone. I'm Ying, co-founder of Smartpeep. So Smartpeep is an AI health tech company that builds AI patient sitter systems to help nurses and caregivers to automatically monitor and respond to patients with high fall risk and cognitive impairments, such as like dementia, Alzheimer, Parkinson's type of patients, to prevent accidents and improve the quality of care. So our advanced solutions uses AI and computer vision to automate patient monitoring for prevention and detection, helping nurses to extend line of sight, alert when there's risky behavior detected, and automatically generate insightful data and reports to help the nursing team to understand individual patients' needs, especially for those who can't voice out for themselves. For healthcare management, our AI system helps them to optimize resources and solve the shortage of nursing workforce. So Smartpeep AI system is being used by the hospitals, nursing homes, and assisted living in Malaysia, Singapore, and Australia. To date, we have helped our clients to detect more than 2,000 risky cases and assisted more than 400 patients. Our mission is to transform healthcare facilities to be a safer place for the elderly using AI, and we are committed to help elderly age safely and reduce caregiver burden. So at Smartpeep, I'm involved in the marketing, operations, deployment, and product design. I work closely with the clients and users to deploy the system in their facilities, improve their nursing workflow and quality of care with AI assistance. I co-founded a company with 3 partners in 2017, and they are the experts in AI, machine learning, IT, cybersecurity, and camera technologies. I look forward to today's discussions with all the speakers and Chiak. Yeah, thanks.
Thank you for the insightful introduction, Ying. Let's move on. Rajifah from Data8, over to you. Good morning.
Hi, good morning, Chiak. Thank you very much. Thank you, Chiak, and also thank you, DoctorOnCall, for having us today. So basically, my name is Rajifah, the CEO and founder of Data8. And what we're doing is basically Data8 is a technology startup company focusing in health tech. Yeah. So the solution that we have developed, what we call as Heart, is a personalized healthcare app that allow us to own our own medical record. So what it means is basically by using our phone, we can track our medical data, we can share and also transfer all those things with our doctors and also with our loved ones. So the reason why we are doing that, basically, if we can see at the moment, our healthcare ecosystem doesn't allow us to really immediately have our medical records. So if we go to Clinic A, for example, then our medical records will be kept at Clinic A and vice versa, right? So by developing Heart, we would like to empower people like you and me, to own our medical record so that we can share it with our doctor. As simple as that. And actually, the second reason why we developed this personalized healthcare app is eventually what's going to happen is we would like to develop a machine learning so that it be personalized according to your own health data. So eventually, that will come to it. So we would like to share more in this session about our plan moving forward. Thank you.
Thank you, and thank you, Data8, for working towards democratization of the patient information. And last and foremost, happy to actually have Ricardo from AstraZeneca over as well in our panel today. Over to you, Ricardo.
Good morning, everyone. Thanks, Chiak, for passing the floor to me actually to do this short introduction about myself and AstraZeneca. So basically, I'm very delighted. First, I would like to thank. Delighted to be invited as the speaker for this KL Startup Summit as well. And first, I would like to introduce myself. My name is Ricardo Wong, and I'm the head of IT in AstraZeneca. I've been with AstraZeneca for 4 years, basically digitalizing and simplifying the AstraZeneca employees' daily life. Okay, we AstraZeneca are a global science-led biopharmaceutical company that focuses on the discovery, development, and commercialization of prescription medicines primarily for the treatment of disease in these therapies area like oncology, cardiovascular, renal, metabolism, and respiratory. We're based in UK. AstraZeneca operates in over 100 countries. Our innovative medicines are used by millions of patients worldwide. Okay, and in Malaysia, our marketing company was established in 1981. And this year, we are commemorating our 40 years of presence in the country. Our AstraZeneca headquarters currently hosts 2 business entities, which is the marketing company and as a global business services hub. Okay, both of which employs approximately 500 Malaysian. Of course, that last but not least, we can share, more and more experience that I've gone through, throughout my endeavor. And I have been in this IT industries for almost 18 years. Yeah, and leading, a lot of projects, and currently we are focusing on digital healthcare system as well, in order to help patients and HCP. So, and of course, we have a digitalization of a healthcare, a patient affordability program. Of course, I can go on and on if times permit, but in terms of this, without further ado, I would like to pass the floor back to Chiak. Thank you so much.
Thanks, Ricardo, for sharing AstraZeneca as a whole. Of course, AstraZeneca, as you know, is extremely in the news, very much in the news right now for obvious reasons. But we'll try to keep those questions at bay, because today the focus on our discussion is actually mostly focused towards digital disruption. So just a quick time check. I think we are doing well for the time being. So I think that permits us to actually take more questions towards the end of the session. Having said that, to all the audience, actually there's an opportunity to ask the questions to the panelists and putting your thoughts as well. So as you can see to your right hand side, you can see the chats and the Q&A. Please do post them across, and we'll endeavor to address them at the end of the session if time permits. So perhaps let's move on. We want to give each of the panelists an opportunity, and also to kind of describe and articulate how the organization has adapted and devised strategy and initiative to navigate through all these unique opportunities and challenges in this uncertain market. Again, I just want to take this opportunity to kind of set the context a little bit. Uncertain markets not necessarily just implies the COVID-19 situation. Of course, everyone here, I think I am tired as well of the COVID-19. But I think what I wanted to kind of like set the context for our panelists and also the audience is a unique, uncertain market doesn't really just mean the COVID-19 pandemic. It actually can it could cover a lot of factors as well. Whether it's we're anticipating as all the economists are anticipating the anticipated recession. Just for a startup perspective, it's very hard to secure the financing. And if I say you are an established startup, how do we hit the milestones, regulatory challenges and hurdles, working with all the stakeholders, lack of market access, competition, whether it's from the local market or the foreign competitors as well. So again, this is going to be a unique opportunity for each of the panelists to share their sessions. So maybe we'll just pass the stage over to Kenneth from Shopee to kind of articulate his thoughts for now. Kenneth, over to you.
Thanks, Chiak. Yeah. So in terms of an interesting word you use, answer, right? I think that's a very apt word to use. I think in the e-commerce space it's always been uncertain in a way. We are sort of crafting a path for ourselves. Especially in this region, in Southeast Asia, right? So COVID was definitely unexpected, and the scale and also the length at which the whole pandemic has lasted so far. But as you rightly pointed out, besides that, there are also a lot of changes that happens even before COVID or even after COVID. So in Shopee, actually, probably just to share, the key thing that we have always been doing since day one was to understand that that how quick we can adapt to market is a very key decider on whether we win the market, right? So the market will do what the market does. There will be changes, and you can't predict everything. And no matter how good you to forecast the future, the only thing you can be certain is that your forecast will be wrong, because there will be changes, right? And a lot of time, a lot of people see the changes, right? But are you able to then digest what it means and then react quick enough executionally, right? So that whatever crisis it may be, right, you do the right thing for the market, right? So in terms of example, perhaps you think of say COVID, for example. The when it hit sometime when it really hit sometime like in March last year, and people work from home, and there's a lot of movement restriction. From outside, you will see that you tend to see that that brings a lot of traffic online and a lot of purchases online and everything, right? But the truth is, although that did happen, but operationally for an e-commerce platform it became a lot more challenging, because we have our workers as well. There's now working from home, and we have our warehouse people. A lot of warehouse people used to follow SOP and all that, right? At the same time, the demand surge. Our logistic partners and all that, are they able to cope with it? People need their essentials fast enough. then we have to make sure that the prices remains competitive, affordable for the people. There's a sudden need for face masks beyond what's usual. And if everyone remember, there's a shortage of face masks for quite some time, and then a price control around it. So for that, for example, so in Shopee, we pivoted entirely, right? We changed the entire platform, focusing on essentials, focusing on low price points. We partner with all our partners to make sure that the volumes are there, the supply is there. And in fact, we specifically source overseas for face masks, and keeping the price below what the government asked for, right? The price control, and keeping it even below those numbers so that it continues to be affordable, and making sure it's available every, right? And we bought in bulks to our own warehouse to make sure that the supply is there. And in fact, because of the demand was so high, and the logistics from overseas was also disrupted, the shipping lanes and all, right? So we have to think of our own logistics and bringing those masks in. So, in terms of cost and everything, it was actually fairly challenging operationally how to do it, but it was important because we also understand that we are part of the Malaysian ecosystem, right? We are part of the country, so we have to do our part, in these situations. And we have the network overseas, we have the infrastructure to bring those supplies in. So did that for quite some time, right? So those are the things, for example, that we have to adapt as things change. Then when the MCO loosened for a while last year, the demand also changed. So I think the good thing that we have on the digital platform is that we are able to monitor the changes in demand fairly quickly, and to respond quick enough as well. So we are offering what our users want. And when I say users, right, I think the key differentiator, especially of us, I think when we think about platform, we understand that we are essentially a ecosystem player, right? So users, not just our buyers, but our sellers as well, brand partners and all that, who are also affected from in terms of business, right? So how do we make sure that the economy is sustained? How do we make sure that they continue to have the relevant cash flow? So therefore, we also launched, in cooperation with government, during the Penjana program, seller support packages, where there are incentives, they are essentially providing assistance financially to the sellers so that they continue to be able to survive and thrive after this, right? At the same time, we also did collaboration with the MMA, Malaysian Medical Association, right, to generate donation for the frontliners, for example. So these are very local things that we do because we are part of the local economy. Ultimately, I think, will there be more changes? As you say, the word uncertain, yes. Do we know what will happen next year? We can't say for sure, right? So how in tune we are with the market, how fast we can see the truth and the implications of it and react to it will ultimately be a key to success, I think. And then that probably applies to everyone. Thanks.
Thanks, Kenneth. I really appreciate your sharing. Personally, I think over Dr. because I look after the customer service and also operation as part of one of my line of duty, I definitely can appreciate the fact that Shopee being such a mammoth e-commerce platform during the MCO and CMCO, how do you fulfill that logistic challenge? Definitely, I can appreciate the hurdles and also on this uncertain market. So maybe let's move on. In the interest of time, Wee Yong, over to you from Esyms. Perhaps you can do your sharing. Thanks.
Okay, hi, thanks. Okay, so without further ado, I will just directly jump into the keyword of this segment where we're talking about uncertainties. Okay, I mean, in my opinion, when I come across this, when we first set up this our platform, where our initial thought was pretty simple. There are like 3,000 community pharmacies out there, and then we tap into the independent community pharmacies where we try to combine these people. And in that, we come in as a very neutral thought. Like, we don't, as what people say, each time whenever there's a new startup, there's a new system, it's gonna be disruptive, and they're coming into to affect the rice bowl. So that's what always the pharmacies and also every players in the market will always see it that way. But how we introduce ourselves, Esyms, we actually position ourselves being a neutral platform, like I mentioned earlier in our introductory, where we actually encourage all the relevant pharmacies, doctors, and other healthcare providers, and then to come to a system where we're actually building a transition towards the future of the healthcare. This is the time where people usually will think like, the future of healthcare, when you talk about AI, when you talk about, all these things, is like you're preparing for the, next thing about robot, drones, or, delivery of medication and such. I mean, for our market, exactly, obviously, we are not ready for all this yet, because the conventional business model has been around for decades. So when I first introduced my platform, my clients in this case is not only just the patients, the customers, the consumer itself. We're also dealing with the merchants, which are the pharmacies. So by having a platform where we need to fulfill the needs of the consumer markets, where most of the time they'll be looking at, pricing, of course, is one of the main thing, and then the variety of the, products and stuff like that, and then the trustworthy of your platform and your fulfillment and stuff like that. So that's one part. And then the second part would be on the merchant side. What can you bring to us in that case? For example, we're telling them, hi guys, we're bringing leads, we're bringing all these traffics for all these users to your pharmacies and stuff like that. And then, this can help to sustain your business initially, where you're just competing with the, all these chain pharmacies in the market and things like that, and the uncertainties of the market, like what you mentioned now. So whatever the keyword that we'll be looking at so far has been on finding the balance. You can't bring too cheap. When I use the word cheap, it means lower the pricing so as to just attract the customers to come to our platform. So while looking for the, if you go too low, your pricing, then the pharmacy will have problem, will have the issue. How are we to fulfill this kind of orders when, each time whenever, the consumer thought when they come to a pharmacy, they're looking for, comparing of pricing and things like that. So that was one of the biggest pain point that I've been trying to tackle all this while. Whatever that we've been trying over the time, we're trying to tell them, you are not getting the cheapest, you're not going for the lowest price here in our platform. But in terms of value, what kind of value that we can really provide to them? So of course, initial thought was pretty simple, in pharmacy to your doorstep. So that sounds implying to everything to convenience. So, instead of you going all the hassle, finding parkings, going through the traffic jams and stuff like that, and then queuing up in the pharmacy. So we bring everything through our digital platform and things like that. Supposedly that can, cater for that, but it's never enough. As we move on, we start to face all this competition from other platforms and even pharmacy themselves. So, by saying that, I start to realize that the main obstacles in pushing this whole thing, initially my thought was simple. We're building trust. We're building, the professionalism among pharmacists. You should come to us because you trust us. We are pharmacists. We are professional pharmacists. You know who we are. While talking to us, everything, the transparency and things like that. So I spent the first 2 years just to reach this trust. But last year itself, when the pandemic struck and things like that, it sort of accelerated everything. It's the same. We go to telling people who we are, what we're trying to do. People start coming to us because of the urgency. So, things change. Of course, it serves both pros and cons. By having people come to us, suddenly there's a sudden surge of demands where people start asking questions and stuff like that. But still, it doesn't really serve what we're looking at. So, like what Kenneth mentioned just now, pivoting, that's what we've been doing throughout. At one point, we thought like, that's the time where if we're able to cater for all sorts of needs in terms other than information, such as all this, the face masks and all the things that people are looking for. So we try to source all these things just to cater for the needs of the merchants and also for the user base. Merchants, they need stocks. They come to us. Hey, guys, you have 400 farms. Are you able to find us some stock here and there? And then, hey, they come to our platform. Hey, is this a better choice of sanitizers? Is this a better choice of, all these detergents, all these antiviral and stuff like that? So we'll be answering queries. At one point, I was in the midst of really, what was my initial point when I first set this whole thing up? It's like, are we looking at being a wholesaler trying to, furnish all these independent pharmacies with stocks, and then, or are we looking at, serving the consumer, giving you the cheapest items, or trying to sourcing out item and things. So this is just one segment of it, the e-commerce part of it, where what can really a digital platform of pharmacies can do for the user and for all the players. So, but whatever I'm saying right now is like, in order to find the key to sustain our business model and to build this whole system in order to provide the key thing that we're trying to reach out. I realized that all this through partnership with every other members in the segment in this industry. So till the end of the day, we are like last year itself, after the pandemic hit and up to now, we realized that till the end, the delivery comes in when people start to know you. So the educational part, where we're telling people what we can do, what are the things that we can provide and things like that. Till the end of the day, yes, it's throughout the efforts that you have been telling people what we ultimately want. So that's why I start to realize that people would appreciate who you are for what the effort that we've been doing. That's why because of last year itself, we have a lot of opportunity, like I mentioned, the government through our CSR projects and things like that, we do more reach out and that. So it more or less it helped us a lot. It accelerate all. Initially our business plan for the next 3 years is all accelerated into the 1 year, and whatever that we plan for the next quarter, suddenly we have to do it now. And what we initially thought we were building, we have to delay. So everything changed. So whatever it is, I think the key to this whole thing is pivoting and change according, we have to adapt to whatever the current situation. Yeah. So that's for my end. Thank you.
Thank you, Yong. Actually, when you explain that whole conundrum that you faced for the past a year and a half, I can imagine, there's a massive whiteboard in Esyms in the office. You're going to be pivoting over here. Okay, maybe for next week, let's do this. I'll say, no, let's do that. It's like,
exactly.
Wow, what a journey. Definitely what a journey. Thanks for sharing that. That's very, very insightful. So maybe let's move on to Ying Wei from Smartpeep.
Thank you, Chiak.
To you.
Thank you. Yeah, my sharing from Wee Yong and Kenneth, and thanks so much for ensuring all the citizens, we have enough supply of all these essential products, masks, and medication. It's very important. Yeah, thanks. So for us, Smartpeep, right? Actually, when the pandemic started last year March, all the nursing homes locked, and hospitals also restrict the access for vendors or new product installations. Yeah. And for our overseas business, like in Singapore, Australia, country lockdown as well. So we can't travel very easily to those countries to meet our clients. Yeah. So initially we have many meetings lined up in overseas, but all these meetings were canceled because of COVID-19. Yeah. So here, I'd like to share a bit about our strategy and initiative, how we actually tackle this uncertain time since last year. Yeah, from two perspectives. One is from our company and also our business. So for the company, right, we know most of the companies in Malaysia and also overseas, they retrench and also cut salary. But we issue bonus pay to our employees at the end of last year to keep our core talents and to boost their morale and fighting spirit to the max, so that they can continue to help us to help our clients and our elderly patients. Yeah, and besides that, we also, because for us, we are building a very niche technology and niche target group. So it's also very challenging for us to hire good talents to build the products and provide the services. So what we do is we hire interns and we train them starting from day one when they join us. And eventually we hire them to become our full-time team member. Yeah. So in terms of our business after COVID-19, right? All our meetings were canceled. Yeah. So we were, so the team were thinking, should we pivot or should we expand new business? Yeah, just like what we own business now. Yeah. So eventually we decided to expand our products, moving from hospitals to nursing home to the assisted living solutions. So if you go to our website, you'll be able to see our products called SP Smart Home Care. So that is actually our new products that came out during COVID-19, that we work together with the nursing homes. We empower them to provide remote care and monitoring to the elderly at home. Okay, why we have this initiative? It's because we receive requests from the nursing home and also individuals, like family member, asking us whether we provide these solutions to elderly at home. Because of COVID-19, many family members cannot go back home to a company or to take care of their elderly. And a lot of elderly, because of MCO, restricted movement, they stay at home most of the time. And some have, some start to develop issues like problems like mental health issues, or their body starts to get deteriorated. They have stroke or have fall at home, all this kind of different conditions that happen to the elderly and require monitoring and help. Yeah, but family members are not there, so they start to look for this remote monitoring from us and also from the nursing home. So we decided to take this chance to work with our nursing home partner to provide these solutions to help more elderly, help the family members, the children who are staying overseas, to take care of their elderly parents in Malaysia. Yeah. Besides that, we also cooperate with conglomerate to integrate our AI solutions into their consumer products. So this is also a way for us to scale our product to more regions. Yeah. So actually, after the first wave, after the first MCO, right, we received more interest from the hospitals and nursing homes. After a few conversations, then we found out actually during the first MCOs, the hospitals and nursing home, they realized there's a shortage of nurses in their facilities to take care of the patient and seniors. Because of COVID-19, family cannot come back. They will send some of the elderly, for example, with dementia, Parkinson's. It's very hard one person to take care at home. So they will tend to send these elderly to the nursing home to receive 24 hours quality care. But at the same time, there are a lot of nurses actually become the frontliners to serve the COVID-19 patients. So other facilities, they are facing a shortage of nursing workforce. So they are thinking, they start to explore using technology, to help them to maintain and even provide a better care, even when they are facing a shortage of workforce in their team. Well, I just want to share another information for everyone is that in year 2030, according to the International Council of Nurses, ICN, they estimate that there will be a shortage of 30 million nursing workforce due to the COVID-19 effects and retirement of the nurses. Yeah. So that's actually how we were able to tackle these challenges during COVID-19 by expanding our business, expand business, form new partnerships, and also train our own talents, keep the core team members, make sure they have great morale and spirit, continue to grow the company. Yeah, thank you.
Thanks, Ying. Thanks, Smartpeep, for actually providing the platform for the nurses in order to advance their services across to the needs. Thank you for that. Moving on, let's head over to Rajifah from Data8 for her own thoughts and also opinion.
All right, thank you again. Basically, we have got our fair share of challenges and opportunities that we have faced along the way. Basically, just for your information, Data8 was formed back in 2017, but it wasn't but it was not, we started building Sihat actually not immediately, because Sihat, as we have before, it is actually built on blockchain platform. So we have to find some time to find someone who is willing to join our team and who is willing to take up a new skill, i.e. to develop a blockchain platform for medical health. Yeah? So that is something very, very rare because what happened in Malaysia is when we talk about blockchain skills and also expertise, we have that, of course. But most of the expertise here in Malaysia, they are more interested in terms of building cryptocurrency, but not in terms of application for industry. Yeah. So we had to spend our time more than one year plus to look for that for that team member. Yeah, and when we finally find the team members, basically only then we started to build blockchain platform. So we started building it back in April 2019, and then it took us about 6 months to develop the platform. And at first we did our pilot at one of the GPs in KL. Yeah. And then during the pilot project, what we noticed is that in addition the medical data interpretive platform that we built, we also need to build a gateway of which we have to receive the medical data, right? And at that point of time, we also developed what we call as the clinic management system, or the CMS. And then we realized there's a lot of players already in the CMS ecosystem. So henceforth, we decided just to focus and build our core system, our core experts in medical data interoperability, right? So having said that, since we have here a lot of founders and a lot of CEOs running their digital platform for medical health, yeah? So we would like to invite potential collaborators to use our medical data interoperability platform so that you can have an added value to your customers, to your clients, of which you can enable your end users to finally own their own medical record throughout the ecosystem, yeah, as they move from one GP or from hospital to another hospital, from one pharmacy and whatnot, right? So that is what we are offering, guys. Please make use of our data, of our platform. It's API ready, so we can almost immediately integrate with your current system, right? Now, having said that, the challenges that we have right on the onset of developing the Sihat are two things, yeah. The first one is with from the regulatory perspective, and the second one is of course from the technology perspective. Now, before we dive into that, let us just share with you our experience during the COVID-19, what happened, yeah? So March 2020, when we first had our MCO, basically we were called by Sungai Buloh Hospital to help them develop what we call as a triaging and management system for COVID-19 patients. So that was what we did. We developed the system 2 weeks, and since then we have already got about 13,000 users, those who go through Sungai Buloh Hospital to get tested for COVID-19. Now, we are doing that on pro bono basis. Yeah. But then again, the lesson from that is basically it opens up the door for us. Yeah, because it's not easy to get into public healthcare system, as we're all aware of that, right? But of course, by doing that, we have got already like 1 foot in. Yeah, and it just make it easy for us to really enhance our collaboration. And now under the NTRS, or the National Technology Innovation Sandbox, we are now collaborating with 2 hospitals, 2 public hospitals, i.e. the Sungai Buloh Hospital and also the Hospital Kuala Lumpur, right? Now, coming back to the challenges, first, regulatory and also technology. So when it comes to the regulatory challenges, we are talking about the ownership of medical record. Okay, right. So in Malaysia, we have what we call as the MMC guidelines on medical records, which was drafted way back in 2006. Yeah, so you can imagine what happened during those times, 2006. So basically, what happened was, according to the MMC guideline, the medical record definitely belongs to the healthcare providers, i.e. the hospital and also the clinics that we go to, right? But that was drafted way back in 2006 when the technology was not so advanced, right? We have right now. Okay, so moving forward to 2021, we have our smartphone, we have the technology ready. So with all these ingredients we have at the moment, that allows people like you and me to really manage and own our own medical record, right? So based from that particular regulatory perspective, the challenge now then for us, and we are lucky enough to be enlisted under NTRS program, yeah, to really sort of convince or lobby the policy makers to really have a look at the regulatory or the guidelines that we have right now to also allow patients to own our own medical records by default. Okay, by default means at the moment, of course, we can still own it, but we have to request, yeah. And when we request, we have to wait for quite some time to get it printed and to get it handed over to us, right? And sometimes during the emergency, that one is not really an ideal scenario that we want to go through. Okay, so that's that when it comes to regulatory. And when it comes to technology, of course, we are building this on blockchain platform, right? So one of the reasons as well why we are enlisted into an NTRS, because we would like to test out our blockchain platform to make it sure that it's reliable, that is secure, that is private. And that is also the very reason why we are now collaborating with the Cybersecurity Malaysia. Yeah, because we want Cybersecurity Malaysia to really have a look, to assess and also to validate our platform that it is indeed secure for us to keep our own medical data, right? So those are the experience that we are going through at the moment. And on top of that, we will also like to share with you our recent initiative that launched like two weeks back. Yeah. What happened is basically we are also collaborating with TM, Telecom Malaysia. So in order to provide the last mile access to healthcare to the underserved people. So underserved, i.e. we are referring to those places who do not have enough or sufficient internet access. Yeah. So the reason why we are collaborating with TM, because TM has got what they call as the Pusat Internet Community, which is spread across Malaysia. So they have got about 400 centers altogether, right? And what happened is we are providing our telemedicine or teleconsultation service. We're going to put it, it is already being used at one of the Pusat Internet. So what happened is people living in the area of PIK, in short, Pusat Internet Community, so they can always come over to PIK and do teleconsultation right away with their doctor, especially when they have a follow-up with their physicians and doctors and whatnot, right? So the reason simply is this. Because when we talk about healthcare, when we are living in a city like for example, or Ipoh, it's very, very easy for us to have access to the doctors. Yeah, because in certain radius, we can easily find a GP or a clinic kesihatan and whatnot. But those really living far away from the city center, where access to healthcare is a challenge, then that is where we are providing the last mile connectivity to those living in the underserved area. So, for example, if you do not have access or if you do not have internet at home, what happened is you can always come to this PIK and you can use the facility there. To have a proper settings for you to get consultation from your doctor. So what we are trying to say here is basically as a startup company, what we are looking into is to solve real life issues, not only faced by us living in the urban area, but not to forget those also living in the underserved areas. So which is something really, really crucial for us to also address that as a technology startup company. So I hope that is something meaningful for, in terms of sharing session for today.
Thank you. Yeah. Thank you. Thank you, Data 8. Again, congratulations for your acceptance into MOSPI NTIS. That's obviously an amazing fit.
Thank you.
Over to you, Ricardo from AstraZeneca. Hopefully you're not kept in the cold there. I can see you're making yourself very comfortable, but it's time to back in action. Over to you, Ricardo.
Back in action. Very interesting topic that is shared by all the speakers. I concur everything that they have shared. For example, like Data 8, they're sharing the blockchain, the very secure platform as well. And Ying Wei on the area that is taking care of the elderly and all that. This is part of the healthcare ecosystem that we need to focus, in the current, situation or the current market. And of course, Wee Yong as well, in terms of the delivery to the doorstep, that is part of the ecosystem as well. And Kenneth, in terms of pivot to digital, is one of the area that we move ahead. On all the challenges and of this uncertain market, yes, no one can predict in terms of the current situation, right? No one can predict there's a pandemic. No one can predict where we are right now, like we are in digital world, right? That's where everyone's need to adopt digital nowadays. No one can actually predict this, right? Everyone needs to live it because we used to actually to meet each other, physically. But now, actually, pandemic has really drive us ahead. So, in terms of AstraZeneca, as a pharmaceutical, and IT and digital actually cut across all the areas. What we need to take care of is our internal employees, one of it, right? We need to ensure that employees can stay engaged with the HCP. And the other hand, we need to take care of the patient as well in terms of the treatment. So these are the areas that we need to focus. Of course, I mean, we not only just focus on the science and medicine part of it, but we also value in terms of technology in order to help us to drive accelerate science, right? And we also highly leverage on digital platform in order to build a better healthcare ecosystem, or to uplift the healthcare ecosystem of for the HCP, and also take care of the patients as well. In terms the ecosystems that have wellness that actually cut across all the pillars, that starts from disease awareness. I mean, I do think that most of the patients, most of people, I would not say patients, but most people do not understand the importance of disease and how do you take care. So that plays a very important role. Then the next thing is, how do we drive in terms of diagnose, okay, early detection, okay, and get them to actually to go early treatment, to get treated early rather than waiting for the disease to get worse. These are all the ecosystem that we need to actually gel everything together using a digital platform to actually to uplift to the next level. And of course, treatment as well. I think all the speakers have shared, I mean, or everything that actually contribute to the ecosystem, like they're delivering medication to the doorsteps, okay, providing, I mean, patient affordability program, and what we do in AstraZeneca. We leverage on these digital platforms. So, I mean, without digital, I don't think we can meet each other nowadays. As during the pandemic, I think everyone are afraid to actually to meet each other. Humans are afraid to see humans, right? You see people in the gut house, you run away and all that because you're afraid of being infected. But digital helps to connect us and reduce the risk. I mean, for us. And also, would like to share that proudly to share that in terms of AstraZeneca has been identified most most innovative pharma company with their digital by IQVIA report as well. So talking about pivoting to digital, how we actually helps in terms of AstraZeneca, we don't develop apps like or AI platform like Rajifah, Lam Wee Yong, and Kenneth, right? But we leverage on partnership and of course and of course adoption as well in terms of platform in helping the patients, internal staff, and of course the HCP as well. We only based on adoption and how do you drive what is adoption. But now we need to take an example like during the last pandemic. What we need to do for the first thing is we always need to act with urgency, right? In order to pivot to digital. So without all this planning in place, I don't think we can always stay engaged like where we are today. Like at the current digital maturity stage that we are in, I will see that this only be achievable in 2023 or even 2024. But with this pandemic actually has accelerated all this initiative upfront, right? I think it is good and bad as well. I mean, in terms of good is the technology has evolving and getting more and more advanced. And to share what initiative that we take to actually in sustaining our business and stay engaged with the HCP and helping our internal staff is we activate the virtual platform like Viva Engage for the sales force to actually to stay engaged with the HCP virtually. That's the only way that we go. So how we need to drive the adoption internally up to externally to the HCP. That is a very tough part of it because we are very prone to actually meeting each other. So how we drive the initiative, that's process, right? So, but we need to speed it up within a month because before the lockdown, else everything is not achievable in order to have a successful pivot to digital. And of course, we need to improve the consent management as well. Of course, we can't, simply invite doctors to actually to attend the virtual meetings. What we need to do is to have the consent because we need to comply to compliance. We need to, live with the value that we do the right things as well. Like we can't be sending an email, to the doctors and invite without their consent. But what we need to do is to improve the consent management system as well, in order for the reps to actually take it to the next level to send an invitation to the doctors. And of course, not only that, That is for a one-to-one engagement like remote detailing. But what about groups meeting? So we have, I think everyone are familiar with the digital platform like Zoom and Teams that we are leveraged on. One thing that I would like to stress on is the Teams. In AstraZeneca IT pipeline, actually we tend to actually implement and go live in terms of Teams in 2020 October. But this pandemic really drive this, project ahead. The IT team really put, at the back end, really put a lot of effort in terms of accelerating this project ahead of timeline, which is before the pandemic, which is in March. Imagine we have moved this 6 months ahead of it. So that is a tremendous, achievement that the IT team has actually done in order to strive this project ahead. That is to enable the internal, internal customer, I would say, or the employees to stay engaged with each other internally and externally. So see, this is how we actually strategize in terms of how we pivot to digital in order to taking care externally and internally. And of course, we have emails for the targeted messaging as well. We leverage on this CRM platform, which is Viva. We have Viva approved email. Probably everyone must be thinking, what about Viva approved email? But why we have Viva approved email is because it's just an email that we send to the ACP or doctors. How we do it differently, because we don't want the doctors to get spam, because most of the healthcare industry now, actually the ACP are complaining that we are spamming them, because we send everything to them by doing an email blast without asking permission. But now actually with this Viva approved email, we seek their consent after the remote detailing before we actually send to them. So that's create a slight difference. But of course, we have a platform, we adopt a platform called as Simple Email Services. Basically is to do an email blasting as well. But we only use that when it's necessary. For example, like is something that important for the doctors to know, like previously, how do we handle this COVID-19 situation, right? The sharing that we think that is important for them to join the webcast. So talking about webcasts, I think everyone are familiar with webcasts. During that time, probably is something new that we need to drive adoption, because some of the people might not be liking digital because they want the physical event where they go to the hotel, right? Sit down and get to do some networking and all that. But that is how we need to educate them as well, and slowly drive the adoption level to the next level. But having podcasts, at first they might be surprised. They might be thinking, wow, how actually this happened? We get to connect with each other, we see each other, we can deliver the right message to the audience and all that. Yeah, at that time, everyone that is not used to digital, they might be surprised, to see this. But nowadays, it's different. We need to think of an innovative way in order to run this webcast by leveraging on green screen. I think everyone has heard about green screen, right? To make it more interactive and more engaging. And not only that, but in terms of AR, augmented reality, right? By looking at it, green screen, everyone's thoughts is something like a news reporter, like what you see in news and all that. But then we need to think of another way, is like AR, probably to get them to over another device to a market who can see something floating. They might be surprised, well, something is floating there. It's something that I never experienced before. So these are the innovative things that we think, within the organization. But that is only facing externally. We also actually cater, in terms of the digital plans for internal customers or employees as well, like learning and development. I think everyone knows that there's a lifelong learning. We can't stop learning until we die, right? Now currently we are leveraging on digital world. We can be connected anytime, anywhere, right? So that we introduce some digital platform which we have in AstraZeneca, like Degree platform. I think some of the organization actually adopt this platform and implement this platform as well, like Degree, Sabah Cloud and all that. That is to keep, it's a platform for the employees to learn and also upskill their development to the next level. And of course, we have a digital platform that actually helps them to plan their individual development plan, goals and all that. Those are the things, digital areas that actually we focused during the pandemic. I mean, internally and externally, in order to pivot to digital. And of course, I mean, we focus on partnership as well. I mean, because one thing, we can't do things alone. I mean, if for AstraZeneca as a pharmaceutical, if we build a platform, it might take years. I mean, right? We need the platform actually to cater, I mean, each and every angle. Then at the other area, we need to take care of the compliance as well. That's where actually partnership actually comes in, like partnering with some startups like DoctorOnCall. Probably in future we can partner with others. I mean, other startups as well, in order to, I mean, strive this ecosystem ahead to the next level. So I think that's all I would like to share as of now, because due to the time, because I can go on and on probably. I may take up, I mean, most of the time from Chiak. Okay, I think that's all from me. Thank you so much. Pass the floor back to Chiak.
Thanks, Ricardo. Actually, I just wanted to let everyone know that I just got the green light from the organizing committee that we can extend the session slightly, because we have another segment. But back to Ricardo. Again, I just like to highlight the fact that actually AstraZeneca is walking the talk, because I'm not sure everyone is aware, but they did launch recently a Digital Health Innovation Challenge. That was in collaboration with the Embassy of Sweden, the Business Sweden, of course AstraZeneca, iLabs, Magic, and MDEC. So the idea for that is actually to get startup players like ourselves to come into their platform to see how we can improve the healthcare in Malaysia from prevalence of NCD diseases in Malaysia, NCD, non-communicable disease in Malaysia. So thanks AstraZeneca for the opportunity for that.
Thanks, Chiak, for highlighting that. I mean, of course, I mean, everyone's welcome. All the startups are actually welcome to join this. Probably, I mean, we have ended the innovation challenge already, but now we are in the midst of shortlisting the finalists. Right? Probably stay tuned for the next one. I think moving ahead, I mean, in terms of for startup, in terms of, I mean, access or extend their business to other markets. This is the way moving forward, by leveraging on all this innovation challenge. Let's get you there, where you get your mentorship, funding, and of course to access to other markets in terms to expand your business.
Thank you, Ricardo. Really appreciate it. So, thanks panelists for your insightful inputs. I think we're going to have one final segment. I think the time permits. Thank goodness for the organizing committee for allowing that. Hopefully, I'm not eating into everyone's lunchtime. So it is a Sunday after all. So moving on to our last segment, we'll close the. We'd like to open the floor. Actually, this is not going to be an individual panel session, but I would like to invite all five panelists to actually give their thoughts and sort of discuss on competition from foreign players. To get to it again, to just add the context, right? A number of players from other markets, for example, from Indonesia and Singapore, they have grown rapidly and they are beginning to expand, or they have already expanded to our Malaysian market. So really right at our doorstep. So what does it really take for a homegrown entity in Malaysia to do the same with such certainty and agility? Again, just to recap, I'll open the floor to everyone so that they can chip in their thoughts as well. Over to everyone. Thank you.
I can go first. I mean, if everyone don't mind. So I think basically it's just to recap on what we have shared just now. I mean, during the innovation challenge, that's why I was thinking to share during this topic. I mean, for you to actually to expand your current business, like the foreign company, how they expand the business to Malaysia and all that. So I mean, it's good. I mean, advisable for strongly encourage everyone to actually participate in all this innovation challenge. That is I would say is a shortcut. It's a short path in order to accelerate to bring your business to the next level. I would say, I mean, with some facts in place, I mean, probably I would like to share, I mean, what in terms of partnership from some startups actually that come to Malaysia is like, for example, Cure.ai. So Cure.ai is a company that's actually use AI to actually to diagnose the X-ray. Okay, that's a company that is based in India. That's actually they partner. We identified them in AstraZeneca during the innovation hub in India. So that's where actually we got hold of this AI, actually then gets to expand their business to not only Malaysia, moving to Philippines, actually moving forward to Indonesia and other markets as well. So because everyone's, I mean, most of the people are afraid of AI and those digital platform because of taking their responsibility away. It doesn't. I mean, for example, like the Cure AI, I mean, in terms of X-ray, I mean, diagnose using AI. I mean, the radiologists might be, I mean, very, I mean, worried about taking away of their job away. Actually, it's not. AI is there to be something like a business partner. It's like a partner for them. Like they only get to diagnose, example, like 20. Just take an example, like 20. I mean, X-ray a day. But with AI, probably they can meet 100 X-ray a day. It's just a partner, but we still need someone to actually to ensure that the AI that is running the right diagnose to it. And another partner is Tricop. Basically, it's also leveraging on AI in reading the endocardiograph report. We get all these based on partnership, and it really helps patient and up to the from HCP up to the patient level. For example, like to diagnose such report, it takes 3 to 4 days. But with AI, it actually reduced to 6 hours. Right. I think that's all I would like to share from my end. Thank you.
Thank you, Ricardo. From the MNC perspective, I think maybe I would like to open the floor to the rest of the panelists, maybe to share on how our Malaysian entities, we are a Malaysian entity, after all, and we actually can compete with the guys from the regional folks.
Yeah, maybe I'll go next. So for Smartpeep, we actually do not have big competitors in Malaysia yet, but we do have a few big competitors in Singapore and Australia. Yeah. So what we need to do in order to face this competition is that we need to continue increase our product quality and enhance the product offerings to make sure that it is hard for our competitors to keep up. So for example, we expand our solution offerings from healthcare institutions to senior daycare centers, assisted living, and at home. Yeah. And also, in 2017, we started with fall prevention detections in room bed exit detections. Yeah, but now we already expand from bed fall prevention to chair and then wheelchair fall prevention. Yeah, and also from elderly monitoring to children or pediatrics patients monitoring. Yeah, so when we continue to expand, it's for your competitors to keep up. Yeah. So next is we also continue to market our product aggressively. Yeah. So for example, one of the strategies is that we talk to the nursing students. We nurture the nurses with new technology, how they can use AI technology to help them provide better care to their patients. Yeah. So all these nurses, they will be equipped with technologies, knowledge. Yeah. Before they join the workforce. Yeah. And also we engage with the right distributors and partners to help us scale and sell aggressively overseas. Yeah. So if we can't be there, we still can continue to grow our business through partnership. Yeah. Thank you.
Thanks, Ying. Maybe we can take one more opinion and thoughts from the panelists before we move on to the Q&A. I'll be quoting some of the Q&As that we have received today.
Perhaps I can share my opinion on this. Basically, in my personal opinion, right, competitors coming in from foreign countries not necessarily be a bad thing. Why I'm saying that? Because as a technology startup company who is focusing on the medical data interoperability, we are always looking out for potential partners that we can collaborate with, especially those with AI, machine learning capability. That in a way can really help us to shorten our learning curve in a way. Yeah. So we always welcome that. And basically, when we talk about implementing or really launching a healthcare initiative in Malaysia, foreign companies coming to Malaysia really need to understand the whole of our healthcare ecosystem landscape, which is in a way unique and in its sense. Yeah. So to us, our foray into providing the public healthcare to the underserved areas, that understanding of the whole ecosystem of how to make it work, and perhaps that is one perspective that do not, these foreign players do not have. Okay, that is one. And also, as a technology startup who aspires to also venture out, I think in Malaysia, we do not have any shortage of programs that is being offered out there, the likes of Magic, for example, Ricardo. So they are offering a lot of initiatives for startup like us to participate and to prepare ourselves for the foreign market. Yeah, that is good. But what from our observation, what lacking and what needs to improve perhaps is everyone's favorite discussion topic, i.e. the funding. Yeah. So of course, when we compare Malaysia to Singapore, the best comparison that we would like that we always have. Yeah. So we always hear for a fact that basically funding pockets in Singapore is much bigger as compared to Malaysia. That is why we are seeing local players coming from Malaysia started to migrate to Singapore in particular, and now we are hearing more and more Malaysian startups also migrating to Indonesia. Yeah. So what is missing then in Malaysia? So that is something the ecosystem, i.e. in particular the funding part, needs to be further enhanced so that we can really help set up companies like Data8 to really blossom not only locally but also in foreign countries as well. Yeah.
Yeah.
Thank you.
Yes,
Yeah.
allow me to add on to what Rajifah just mentioned. In a way, just cut it short. In a way, I agree with Rajifah in the sense that, when we look at this competition, be it from overseas, regional, or, local itself, for me, especially in our sector, I find it helpful when we have, these various programs and, different sectors coming in. It can actually, if we look at the other, we can actually maximize the synergies between these key players. So, if we don't see it as a competition, in fact, it's like, most of the corporate undergoing transformation, the execution part, when we can help to keep ourselves more challenging and then to do better and things like that. Because in terms of, like, for example, when we were talking about this COVID-19 pandemic, it's actually the big push for this digitization. But the rate of, this absorption, the digital adoption is still remaining quite low. So we actually need more players and then more stakeholders coming in. And then if we're able to work together, for example, I'm from a pharmacy, so I'm right here, I'm looking at multiple doctors in the platform and things like that. Prior to this, conventional, business model have been, they see each other as competitors, doctors, pharmacies, and even among pharmacies. But it's only when it comes to platforms like this and comes to, more and more awareness of this, digitalization can help us, to actually connect all these peoples into a platform and then, to explore even further. Because fair enough, add on to what Rajifah mentioned also, like, why people go up to regional, like one of the questions, would we actually choose to go regional? There's only for two reasons. Of course, the IE funding just now you mentioned, and of course, the population itself. So why people would like to go regional when it comes to Bangkok itself, one populations compared to, the whole 30 million population, Jakarta as well. So till the end of the day, I still think that is the key is to find, the real solution, and then the key to what we really want to do through this healthcare transformation. So, of course, one method does not apply for all, meaning that it seems that, at one point, we actually provided a solution that can solve, a pain point at one time. But, as time moves on and things keep changing, who knows? So I find it positive in a way that, more players coming in means, there's more opportunities and, better chance to, create this awareness as well as the development of all this healthcare digitalization. Yeah, thank you.
Great. Thanks, Wee Yong, for your thoughts. Again, I think in the initial time, I'd like to thank everyone, including the panelists and all the attendees, for your time. But I think before we close the session, I just want to take a couple of questions that we kind of was posed by the audience from the Q&A perspective. Perhaps just take one that kind of drawn my attention to is actually from Fadli Kashimi. He's a writer from Business Today. So the question goes in such a way that what can Malaysians expect for the telehealth services after COVID-19 virus passes? Maybe like in 5 to 10 years. So perhaps actually to make things a little bit more broader to the wider audience here, maybe instead of telehealth services, we will say that from digital health perspective, i.e. encompassing the healthcare perspective. So maybe I'll open this question to the panelists as well. Happy to take one of you guys to ask this.
I'll go first. So basically, of course, naturally for us, we would like to see more and more people, people like me, actually, to start owning our own medical records. Because with the advance of technology that we have at the moment, really it allows us to keep our own medical records on our own mobile phone, yeah, which is not possible a few years back. Right, but with the blockchain technology that we have, everything is made possible. Now, let's put it this way. Yeah, right now we can already manage our financial, our banking using our mobile phone. Yeah. So the key takeaway we would like to really pose to the audience today is why not we do the same for our medical data? Yeah, because that will make our life so much easier actually by owning our own medical record. So then we get to decide who do we want to share it, and what kind of data that we want to share, even with our doctors. And in the event of emergency, that is actually can have a huge potential to save life. So we would like to see that happening.
Thanks, Rajifah. So I think I think this could be of interest to you as well. So Ying, maybe you can kind of like both of you can actually see how you can answer this jointly. It's from Dr. Jason. He's actually a patient experience officer. So the question goes in such a way from Dr. Jason is, without an integrated system of health records in Malaysia, how are we going to ensure that the AI algorithm will be meaningful? Maybe Ying, you want to go first? First, let me read that out again. Without the integrated ecosystem of health records in Malaysia, how are we going to ensure that the AI algorithm would be meaningful?
Okay. Yeah, if you're talking about the AI algorithm applied to analyzing patient data, yes, I believe that if there's an integrated health record in the entire Malaysia, similar to how Singapore is doing it, they have agency to integrate all the data in entire Singapore, so that it's very easy for them to manage patients' information, and also when patients transfer from one hospital to the others, the transition is actually very smooth. Yeah, I agree that this kind of AI algorithm analysis will be more meaningful if we have an integrated healthcare record. Yeah, and I believe our MOH is doing that already, especially in the beginning of COVID-19. They started to look at to integrate the data, build the data centers to keep the patient record, and also launch the integrated CRM in all the clinics, if I'm not mistaken. Yeah, but for our type of AI, right, because there are actually many type of AI, like data analytics or natural language type of AI, and our type of AI is more on the computer vision. Yeah, so currently, yeah, we can only bring this data and insight to individual organizations. Yeah, but if we have the integrated systems between all the hospitals, yeah, no matter where this patient goes, right, the nursing team, the healthcare team, the clinicians will be able to serve the patients better even before the patient arrives. Yeah. I hope I'm answering the question. Thank you.
Yeah. I think we have one final question, and actually we have this from Naeem Firdaus. He's actually from ACPM IT. So I think the question goes in such a way that who are the ideal just being pushed my message. Who are the ideal trust service providers? Are there needs for more innovative trust services or products from the service provider to the virtual health industry? So actually, I would like to open this question to Kenneth, actually, from a Shopee Mall perspective, because I understand that this might be a bit abrupt, but I think what I would like to hear from Kenneth is actually how is there any process or any framework that Shopee typically kind of embarks on before they onboard for example, these healthcare players like pharmacists into their platform to ensure that everything all is done in a very safe and conducive manner, and yet facilitating transactions.
Hi, yeah, sure. So for on healthcare in particular, definitely. So we are actually in very close contact with government and the relevant NGOs, right? Like the MOH or Pharmaceutical Society. to ensure that nothing illegal or nothing that needs prescription is sold on our platform, right? Because it is very important to make sure that we are compliant to all that. So we have a dedicated listing team actually who ensures that they scan through every day our entire platform and make sure that we don't have any illegal items. So I think at the time we are partners with some of the key pharmacies, right? Some of the bigger pharmacies that's well known around in Malaysia, and they hold their own licenses, right? You know, in terms of what they are able to sell and what they're able to sell, what's over the counter, what's not over the counter. So in terms of managing the listings, that one we do a very proactive stance to make sure that whatever is sold on the platform is allowed and legal too. Anything that needs prescription, for example, you know, for now, it's still a very offline thing, right? Or maybe it'll be solved by other startups for those more niche items.
Thank you, Kenneth. Actually, just to add on a little bit, maybe because this piece of information was very big in the market. Actually, was covered in the Malaysia, all the Malaysian media as well. So Shopee is collaborating with Malaysian Pharmaceutical Society (MPS) to drive all this safe and safe practice as well. So I just like to add that too from a Shopee perspective.
Can I ask a question regarding accession to this answer from Shopee as well, from Mr. Kenneth? So. In terms of the effort you drive this collaboration with MPS and stuff like that to actually identify who are the pharmacies selling within the platform itself. But the other side of this problem is there are still a lot of unknown sellers selling within the platforms and things like that. So we do heard about sometimes they lodge some complaints and things like that. Why today we can see some sellers in between, they can just add in some of the listed product, which is not when we mention illegal, it means it's still a genuine product from pharmacy, but of course under the law of pharmacies they can't sell, which we call them the poison C and poison B. So it's like, what is the effort by Shopee in this case? It's like, how fast can you actually immediately rectify the problem each time if there's such case? There are many times we actually print screen, we send it, complaints where user can easily purchase all these items from Shopee, and then sellers can just change the name of account and then they just resell again and then just add in all this listing of these products. So my first part of the question is the end point of this whole Shopee involvement in this effort to help in this eradicating all these illegal sellers or products in your thing. What is the thing that you guys are actually planning down the road to really completely help? Sometimes a platform is good when we open up the opportunity for more people to, expose and to get, come across the convenience and those things. But on the other hand, create another problem out of it, meaning that, we actually invite all these people that can easily come into an open platform to, sell all these things. So what is the effort from your end, you guys to do to really help out to really eradicate all these new problems when I'm mentioning this?
Yeah, sure. Thanks, Wee Yong. So we take it very seriously, right? And then that's why there's a proactive way and then there's a reactive way, and we do both. So in terms of Shopee, for example, especially within Shopee Mall, which is where we created a curated section in Shopee, and all the pharmacies within Shopee Mall, those that certified by MPS, and then we have a special let's put it this way. So everything that's within mall, we curate the sellers that's there one by one, so we know who's there, who's selling what, and they are absolutely selling what they're supposed to be selling and not selling what they're not supposed to be selling, right? So within a wider platform, we also take a very proactive stance in cleaning up. As I was mentioning, we have a listing team that goes through and scrape through the platform and remove immediately as and when we see anything that anyone is not selling what they're not supposed to. Any complaints that we get, so we are also relying on our users, because we have it's a massive platform. So any screenshots that we get, the reaction is is immediate, right? It's immediate. We have a dedicated team there to remove all this. And I'm with you. I do think that it's very important to manage it so that there's no we don't push the wrong items to the wrong hands, right? So we do take it very seriously. We put a lot of resources to it actually, and on our content team, our team, and we do have a cadence around it that remove things immediately as and when it's not supposed to be, right? And this goes across all categories, not just pharmaceuticals, right? Including other categories as well, because we are cognizant that it's a marketplace. People there could be people listing things they're not supposed to, so therefore we have quite a large dedicated team on this actually.
Thank you, Kenneth. Thank you, Wee Yong, for the question. I think really I've been nudged twice at least from the organizing team that we are a little bit, actually a little bit is understatement. We are over time. So I think apologies to the attendees. Again, thanks to the attendees for actually your question and also for your spending your afternoon, and now it's the afternoon, with us on this Sunday weekend. Lastly, also I would like to thank the panelists for your time. Really, I was happy and chuffed to actually have you as my panelists actually to contribute your thoughts and opinion, and also representing your respective organization. I also have another note from the organizing committee. I think they want to take a group though, of course through the new way, which is actually via virtually. So actually, I'd like to invite everyone here to give a big smile. Of course, make sure you're stationary so that the organizing team can get a great picture. So I think organizing team, maybe on the countdown of 1 to 3, then you can just snap the photo, and then if you need another one, you can just DM me separately. Okay, 1, 2, 3. Okay, I think we should have one. Okay, great.
I was supposed to do that.
Okay. Of course, we won't stop you, Wee Yong, if you want to have the Oppa Korean style. No problem. We're all good for that. Okay, thanks everyone. Again, have a good weekend ahead, and to see you at the rest of the session today. Thank you, attendees. Thank you all.
Thank you.
Thank you, Chiak.
All right, thank you, everyone.
Bye.
Goodbye.
Have a nice day.